Hi guys, my name is Martyna Erskine. I'm a nurse practitioner at J Wellness Partners, and today on a Lunch and Learn, I want to explain you how atherosclerosis forms and also why standard lipid panel is not enough, like the simple lipid panel, and why we should check more than just that. So first, let's look in a typical lipid panel testing. So we're checking cholesterol, which is the lipid molecule that everybody is so scared of. We also look at the HDL, which is high density lipoproteins. A lot of people refer to it as good cholesterol. However, it's not a good cholesterol, it's a lipoprotein. So it's a protein, like a transfer protein that carry cholesterol, and it could have some good benefits in our body. And LDL, which is low density lipoprotein, it's considered the bad cholesterol, but the truth it's just a lipid protein that carry cholesterol all around the body. And it's considered bad, and I'll explain you why. And the worst ones are triglycerides. Those are the bad guys. Usually we get them from the really bad lifestyle and the diet. So the standard lipid profile measures the amount of cholesterol within the lipoproteins and not the actual number of those high density, low density, and very low density lipoproteins. So I want you to note that. Also, I want to mention that I take that story about formation of atherosclerosis from Peter Attia's book. So I use a lot of his jargon, or I use a lot of his wording to describe how this condition forms. So what is cholesterol? So cholesterol is a lipid molecule that is synthesized in every single cell in our body. It's actually very essential for creation of the cells. The cholesterol in the blood just shows us how much this molecule is transferred and how much this molecule is about to be used for something else. So it's kind of like a useless test and make a lot of people really, really afraid for no reason. So if you have a healthy cells and liver, the cholesterol should be high. So if you are sick, for example, your body has to pull up cholesterol from different sources. High cholesterol, however, can be due to some sickness, dietary sugar consumption, starch, processed fats, like shortening, cottonseed oil, palm oil, margarine, canola oil. I want to mention here, it's not from eating butter, it's not from eating red meat. High cholesterol is usually due to seed oils and a sugar consumption. So that's really important. Sometimes people have it high because of amino acid deficiency or some essential fatty acids, antioxidants deficiency, tissue damage due to some infection, radiation, oxidative activity. If we have deficiency of fiber, we don't eat enough veggies, not enough vitamin C rich food, or carnitine or biotin, cholesterol can be high. And it's also high with some food allergies, alcohol consumption, hormone deficiency, hypothyroidism, and some medication also can increase your cholesterol. I mentioned them here, especially the tamoxifen. It's pretty scary because, we put a lot of women after breast cancer on tamoxifen. Also, I just want to mention that cholesterol is needed to produce testosterone and all other hormones. It's like a precursor to all the hormones. So what is HDL, high density lipoprotein? That's considered a good cholesterol. So think about it as this big, good, fluffy tracks. They have a lot of protein inside them, and they have very small amount of triglycerides inside them. So they mostly build out of proteins. That's why they consider good. They have inside the particle apolipoprotein A, and that's the good protein that makes it good, basically. This one are synthesized in liver and are responsible for transporting cholesterol from the blood and tissue back to the liver. And back to the liver when cholesterol is clear out. So what's the action of vessel? They enters the endothelial layer, which is the inner layer of our vessels, very easily, in and out, in and out. And it helps maintain integrity of that layer. Cause lower inflammation, can neutralize and stop oxidation of the bad particles. So they're like a savers. They go and sometimes save us from atherosclerosis. The amount of this molecule doesn't matter. A lot of people are trying to have a HDL, the good cholesterol levels higher. However, high doesn't mean you're going to be cardioprotective. It's more the functionality that matters. And our simple lipid profile doesn't check for functionality of HDL. None of the testing up-to-date check for that, unfortunately. And LDL, low density lipoprotein, that's the bad guy. Those are those small little tiny scooters that have less protein and mostly triglyceride inside them. They also contain this protein called apolipoprotein B, that's the one responsible for all the damage in a vessel. That's the one that make it bad. So they transport cholesterol from liver to another target tissue. That's what makes it worse too, because they don't transfer it back to the liver for metabolism, more to the tissue and causing a lot of conditions. What's their action? They go to our endothelium, which is inner layer of our arteries, and they get stuck there so easily and oxidize and cause atherosclerosis. And those ones are usually high due to insulin resistant, which is too much sugar consumption, metabolic syndrome, obesity, high blood pressure, all of that, hypothyroidism, so sluggish thyroid, and infections with H. pylori, chlamydia, herpes, cytomegalovirus. Also, they can be high due to leaky gut and genetics. And what are the VLDL? Those are very low density lipoprotein. They're even smaller, they're even denser in fat, they really get stuck inside that arterial walls, and they really cause a lot of issues. What are triglycerides? That's a main form of fat storage in the body. When we consume more calories that we can burn, so eat too much compared to how much our body needs and can burn, those triglycerides are getting stored inside our fat tissue, and that's what makes us fat. And they usually are high due to sugar consumption. Excess glucose turn into triglycerides in the liver, causing fatty liver disease. When we have an excess glucose, that glucose can go to the liver and be transferred to triglycerides, what causes fatty liver disease, or that glucose can go into fat tissue in a form of triglyceride and get stored as a fat, especially that visceral adipose fat, which is like the one around organs, that makes us very, very inflamed. So what are apolipoproteins? Those are those proteins inside that pack lipids together that form a water-soluble lipoprotein. A little number of cholesterol on a pickup trucks versus a lot of cholesterol on a small scooter. So, you know, that ApoA, HDL have very small cholesterol on a big, nice truck. However, those small little scooters has a lot of cholesterol, those tiny little transfer molecules. So what happened when ApoB, the good one, enters our endothelium? It actually enters endothelium, helps to lower oxidative stress, and leaves it, so it's really protective. However, apolipoprotein B enters endothelium and can get easily stuck inside. A number of ApoB particles way more important than how much total cholesterol we actually have, because this cholesterol could be on those good tracks, you know, not necessarily on those small little bit scooters. Exposure to ApoB over time, so more LDL and more VLDL, the greater the risk that will penetrate endothelium and oxidize. So even if you have very healthy arteries, but you have a lot of ApoB in your body, you have more chances that they will get stuck and oxidize. Let's talk about atherosclerosis formation step by step. For some people, just get stuck in endothelial layer for no reason, just because they have a lot of ApoB. However, for most of the population, first there's some endothelial harm that happens in our inner layers of our arteries, and that's usually due to smoking, high blood pressure, high sugar intake, and inflammation. So smoking damages our vessels chemically. Hypertension, however, damaged mechanically from the friction. Sugar damage our endothelium via glycation process, which is like the aging process. Also, endothelial layers are very prone to damage from inflammation. Inflammation can come from anything, from gut, from drugs, from food, you know, pesticides, and all of that. So first, we very often have that endothelial harm. And once that harm happens, then ApoB proteins, they get stuck in that little wound, basically in our endothelium, and they get stuck and they cannot get out because they're small, tiny, and like right in those little gaps. So what happened? They end up being oxidized. How? They come into contact with highly reactive molecules, ROS, reactive oxygen species, and cause oxidative stress. And then when they get oxidized, that kicks off the whole atherosclerotic pathway. So when they get oxidized, what they do? Well, they get large, oxidized, and they stop behaving like a polite guest. They refuse to leave, and actually they invite more friends. So more LDL particles comes in. And what happened to all those LDL particles? They get stuck inside too. So when they get stuck, reactive oxygen species come and they become oxidized and retain in that vessel wall. After that, the whole 911 process starts. Our immune system starts freaking out and sends those specialized immune cells called monocytes, which are the large cells, to go and like deal with it. So they go, they enter that subendothelial layer, and they turn into macrophages, which are even larger and more hungry cells, looking like Pac-Man and acting like Pac-Man. So they trying to eat and swallow and that oxidized LDL, trying to remove it from the artery wall. So this is like a protective mechanism. If we don't have too many ApoB stuck in a vessel wall, this can be very successful process. However, where there's too many of them and too much endothelial damage, then unfortunately those macrophages eat too much cholesterol, and what happened, they blow up and they turn into foam. It really looks like foamy on a microscope. And what happened? Then more foam clump together and form fatty streaks. And we can see those actually with the naked eye during autopsy. So we can take the vessel from, dead people, and we can like open it up and we can see those fat streaks. So this is like already like advanced atherosclerosis. And I just want to mention that this atherosclerotic plaque formation, it's a lifelong process that starts very, very early. It already starts in puberty. So this is like an ongoing process that takes years. So what ApoA, the good tracks, are trying to do when all that happened? They're trying to do delipidation, which is HDL particles arrive to the crime scene and try to suck cholesterol out of macrophages. And then cholesterol efflux happens, which HDL slips back from endothelial layer into bloodstream. Excess cholesterol is moved back to the liver and other tissue like fat cells, hormone-producing glands for reuse. So that's how ApoB is protective against atherosclerosis. However, if the atherosclerosis is very advanced and we don't have enough ApoA proteins to fix it, then what happened next? The foam cells ooze together. And once they ooze together, that's the core of atherosclerotic plaque. So that's actual plaque that we call atherosclerosis. I just want to mention that people with high LDL and ApoB might not show any signs of the disease on a calcium score, because this plaque, it's not calcified yet. So if you do calcium score testing, it will show like a perfect score, which is 0. So then our smooth muscles in our vessels are trying to repair the damage. So they start migrate to toxic site and secrete kind of like a matrix in attempt to build a barrier around it like a scar. Why? So this won't like go loose and leads to heart attacks or stroke. So this matrix ends up as this fibrous cap on a brand new arterial plaque. So we start putting more muscle on it, on top of the fat, and we have this big giant scar inside our vessels. This very often shows on a blood test as an elevated CPR, which is inflammatory marker. On CT scan, it can be missed if you just look for a calcium buildup. Non-calcified low-density plaques are considered higher risk because they are less stable than calcified plaques. So it's better to actually have a high calcium score and don't have any uncalcified plaques that have multiple uncalcified plaques and have a perfect calcium score, because those are very, very unstable. So the plaque continues to grow and expands to outer arterial wall, covers the lumen, which is the passage, and that leads to luminal narrowing, which is also called stenosis. Stenosis basically means narrowing, and this can be seen on a CT angiogram and also on a clearly scan, which we'll talk about those two later. So what's the next step? Plaque starts to become calcified. That's what finally shows on regular calcium score. Calcification is other way of the body to try to repair the damage and stabilize it. By stabilizing plaque, it protects arteries. It's almost like pouring concrete on a Chernobyl reactor. That's how Dr. Attia described it. So what happens if it's not calcified on time? Well, the plaque go loose. So this unstable plaques erodes, ruptures, and cause the formation of a clot. The clot can completely block the lumen of the vessels, or it can travel and cause stroke and heart attacks. That's why non-calcified plaques are much, much worse than those calcified ones. Most plaques are not dangerous, grow gradually, eluding blood vessels until obstruction, and that becomes a problem. sedentary person might not know they have a plaque until they will, like, for example, go and shove the snow, and sudden movement of circulatory system can cause ischemia, which is reduced blood delivery of oxygen to certain tissue, or infarction, which is total tissue death from lack of oxygen. And that leads to heart attack or stroke. So how can we test it though? So we can do calcium score, but like I said, calcium score can be too late. People with high LDL and ApoB might not show signs of disease on calcium score. And positive calcium score just tells us that there's certainly other plaques that might not be stabilized, because if there are stabilized plaques, they for sure are so unstabilized plaques. We can do also CT angiogram. It's more advanced. CT scan identifies calcified and non-calcified plaques, requires intravenous dye, exposes patients to slightly more radiation, so it's not ideal because of that. And 50% of people that have a normal calcium score, which is 0, are still found to have plaque or even small calcification on a CT angiogram, or even high-risk plaques. And the best of the best one is test called Clearly. It's not covered by insurance, but it's really amazing, like a 3D image of all your coronary arteries. It uses the power of AI and coronary computer tomography and angiography. It's non-invasive and analyze plaques and analyze stenosis and give you all this like 3D model of your coronary arteries. And you can see they're like yellow, which means they're just like fatty streaks, or they're like red, which means they're like those fibrotic scars, or the white, they're calcified. So this is like very, very detailed 3D image of your coronary arteries. And it staged them by 4 different stages. How bad is the plaque? So this is the best test right now on the market. Unfortunately, it's not covered by insurance. It's cash-based. We work with this company. If you're ever interested in getting the test, just let us know. There's a couple clinics in San Diego that offer this testing. And now let's talk about the worst of all of them, which is lipoprotein(a). So this one is a very, very deadly particle. It's also a member of that ApoB, those bad guys. This one, it's hereditary. So usually somebody in your family have that elevated, there's high chances you have that elevated too. This one is responsible for that sudden deaths, when people all of a sudden collapse in the early ages and they were healthy, they were very active, and all of a sudden they end up having heart attack, that premature heart attack, just because of the genetic components. It's formed when so many different LDL particles are just fused with another rare type of protein called apolipoprotein A, or ApoA, or lipoprotein A. There's a couple names for it, but it's a little a. Those particles wraps loosely around LDL particles with multiple looping amino acid segments called kringles, and so the structure resembles like ring-shaped Danish pastry. That's why I put like a Danish pastry around it, so to kind of help you guys visualize it. What makes it so dangerous? They pass through bloodstream and scoop up a little bit of oxidized lipid molecules and carry them along. And because they carry those really oxidized bad molecule, they get really, really stuck in those endothelial membrane and can clog the arteries. They're extremely sticky and they're way more likely to get stuck. Moreover, they act as a thrombotic or clotting factors. So they speed up formation of an arterial flux. They make everything around them clot, like how come platelets let clot together. Variation is genetic. 20 to 30% of US population have a high level. Also, people with African ascendant has on average higher levels of that lipoprotein A than Caucasian. So if you have family history of sudden heart attack, please ask for that test, the lipoprotein A. That one is included in our Joy Wellness cardiac panel. If you're ever interested to test it, to see if you have a genetic predisposition to atherosclerosis. So this one, there's unfortunately not a quick fix for this. Doesn't respond so well to exercise like LDL does, because other LDL molecules, you can lower it by a very intense cardiac workout mixed with weights. This one doesn't respond very well to diet or exercise. So what is on standard lipid profile? They usually just check cholesterol, LDL, particles, HDL, triglyceride, and also ratio of cholesterol to this good cholesterol. On our JWP cardiac panel, we check, of course, the simple lipid panel. We also add homocysteine, which when this marker is elevated, that basically destroyed our vessels. It can be elevated when people have methylation issue with MTHFR gene mutation. We also check the good protein, the apolipoprotein A. We check the really, really bad one, the number of it, apolipoprotein B. We check hemoglobin A1C, which is a diabetes marker, because most of the people that have diabetes, they actually die from heart attacks. So diabetes, sugar consumption, and cardiovascular health and cholesterol are all related to high sugar intake. CRP cardio, that's inflammatory marker that we check. We check that hereditary lipoprotein A, and also we check NMR profile, which gives us all the scores. Interesting one is the LPIR score, this insulin resistance score. So tell us if you have insulin resistance. That's the condition that develops before you have diabetes or pre-diabetes. That's when your cells don't want to accept insulin because you had high levels of insulin in blood and a glucose for many weeks, years, or months, and just doesn't accept the glucose as an energy source. So that's our cardiac lipid panel. So how can we treat high apolipoprotein B and high triglycerides? Number one is, of course, prevention. You want to prevent any damage to your endothelium, which will be smoking cessation. You want to manage your blood pressure, making sure you are on a blood pressure medication, or if you're not yet, because it's not as bad, definitely exercise and low carb diets can improve your blood pressure. Number two, good fats. So raising actually HDL concentration has not been shown to reduce cardiovascular risk at all. Low levels, however, are associated with cardiovascular diseases, but they're not causal to it. So the drugs that were raising HDL fail to decrease cardiovascular diseases. The function of HDL, it's way more important, but we cannot measure that function of HDL, unfortunately. The goal will be to increase functionality of the particles, which will be lifestyle modification, exercise, and diet. And I want to mention that oral consumption of cholesterol-rich foods like egg yolks, butter, does not increase your cholesterol levels. So eating cholesterol doesn't increase your cholesterol actually in the blood. It's fake news. Glucose and high sugar intake, and also seed oils like palm oil, canola oil has way more impact on your cholesterol. My favorite omega-3 fatty acids, I put all my patients on it because they're for everything. Immune system, for prevention of dementia, for lowering cholesterol. They can also increase the expression of nitric oxide synthase. And nitric oxide synthase increases nitric oxides, and nitric oxide is this natural vasodilator. I will talk about nitric oxide supplements next. More vasodilation, we have more flexible our arteries are. They can stretch and constrict, stretch and constrict. It's very protective against endothelial dysfunction. It's anti-thrombotic, so prevents blood clot formation. So when people have a very high platelets, or they have to be on aspirin because they're on birth control leads to blood clots, you should definitely take omega-3 fatty acids to prevent blood clots. So it's like natural aspirin. Also, they inhibit the expression of adhesion molecules, so no stickiness, and reduce level of triglycerides. Omega-3 fatty acids, after taking them for 3 months, you can actually see a nice reduction of triglyceride on the blood work, which is really amazing. Doesn't work that well on the cholesterol, but it works very well on triglyceride. But like I said, number of cholesterol doesn't matter. And also they increase antioxidant activity. Regrowing glycocalyx. Glycocalyx is that inner layer. So endothelial layer, the layer called glycocalyx. Those are those very slippery, tiny little hair kind of around that prevents anything stick to it. So you can regrow your endothelium and your glycocalyx by taking Atherosclerosis. It's a supplement made out of rare seaweed and some fruit and vegetable extract. This helps support the integrity and normal function of this glycocalyx. Arteriosclerosis is also my favorite. I put all my patients on Arteriosclerosis, and also on the next one, which is Vascanox. Vascanox, it's a slow release nitric oxide, so it's natural vasodilator. It's a nature's Viagra, because erection is all about the blood flow. So better the blood flow, better erection, less cold hands, better blood flow, better circulation, everything feels better. Like your hair will grow better. So Vascanox is amazing. It's made out of beetroot, black garlic extract, some nutrients, antioxidant, and promotes the exogenous enterosalivary pathway of nitric oxide production. So it can really help to lower your blood pressure. So before people go on a blood pressure medication, I always tell them at least start with nitric oxide. You can eat nitric oxide rich foods like beet, arugula, and all of that. Or you can take nitric oxide supplement. This one is the best because it's slow release. It actually increases your level for up to 24 hours. Plaquex IV, we did it for a couple patients. It's a phospholipid therapy that primarily consists of phosphatidylcholine. That one helps basically repair damaged cell membrane. So that one we did for a couple patients that already have atherosclerosis and they want to reduce it and kind of like dissolve it as much as possible. It can increase the production of your own antioxidant that will go and fight that atherosclerosis, regulates lipid metabolism, so can improve your lipid profile and your circulation, and also promotes vasodilation, which can help increase the blood flow to your tissue and then improve the oxygen and nutrient delivery. Magnesium, another of my favorite one. That one is good for basically anything, but in this case, magnesium is associated with healthy endothelium, helps with those vascular smooth muscle tone. My favorite forms for the heart and blood pressure are magnesium glycinate, malate, and taurate. Red yeast rice, I take that one as well because I have a high cholesterol, and that one it's like a nature's statins. It's kind of like the component of red yeast rice is the same as the statin medications, but I always trust nature's more, so I think nature is smarter than we are, so I prefer to take a plant version of any type of medications. This one, it's made by fermenting rice with a specific type of red yeast. That's why it's red yeast rice. And that one supports healthy cholesterol metabolism. So lowers your cholesterol in the blood, not because like you end up having less cholesterol, but you metabolize that cholesterol better. CoQ10 usually it's combined together with red yeast rice because red yeast rice can lower CoQ10. So we have a supplement that already have them together. CoQ10, it's amazing because it can neutralize harmful free radicals and reduce oxidative stress, which is the culprit of the atherosclerosis, helps to regulate vascular tone, lowers inflammation, lowers blood clotting by inhibiting platelet aggregation. So the same like omega-3 fatty acids, that way you can reduce the risk of thrombosis, which is clot formation. And also, CoQ10 helps stabilize atherosclerotic plaques. Aged garlic extract, that one reduces many risk factors for heart disease, maintains healthy coronary arteries, supports healthy blood pressure, cholesterol levels. It's protective to liver, protective to heart, to kidneys, anti-diabetic, anti-obesity, anti-allergic. If you go on a website, Kyolic aged garlic, that one is my favorite brand. They have, I'm not associated with them, just think they're really good. They have different type of aged garlic extract combined with different additional ingredients to help with so many things like glucose control, or like allergies or inflammation. It's even anti-neoplastic, just like anti-cancer. So that one is also a really good supplement. Okay, there's a lot of other supplements I could talk about. I want to just mention my favorite one. Thank you guys so much for listening. Hopefully you liked the little presentation, how I did all the pictures and everything of the formation of atherosclerosis. I didn't want to scare you. I just want to basically give you idea how slow that process is and how we can cut it on time with the right testing and how we can prevent its formation, prevent at least its progression. It's never too late. Thank you for listening, and let me know if you have any questions by emailing Joy Wellness Partners.